it's an interesting question that you've actually posed. I never really thought about that actually when I still have patients that have lung cancer. Um, I guess I see it as not so important task in terms of where they are at or where they were at that time in their management. Maybe because I see the terminality of the disease on them, and I don't see quick smoke as much as it maybe should be encouraged, if that makes sense. No, they the latest one I have is a lady. She was 72. I last saw her in July. I haven't seen her since then. She was smoking a lot more when she first got the diagnosis, because it was really stressing her out. So that was her way of dealing with stress. She was going on like 25 a day. She would on and off in the years that I've known her cut down when she can, and then she'll smoke more again when she's stressed. But yeah, this one definitely, the whole thing was stressful for her. So she was smoking more and more. I mean, I certainly didn't think that was the timing to tell her, look, maybe you need to quit. So I never brought the subject up at all. She's gone to palliative care since then, and she's moved suburbs, so I haven't heard from her. Or I don't even know if she's still, in palliative care or not.
GPs are in a pretty good position to provide smoking cessation advice overall. So that's with patients with a cancer diagnosis, or patients without a cancer diagnosis and other comorbidities, etc. And I think because of the nature of the continuity of care, I would like to think that we're not everyone's cup of tea. You don't get along with every single patient, but I think if you genuinely care for the patient, you have a good relationship with the patient, and that therapeutic relationship is robust, it just allows us to be in a good position to talk about smoking cessation, and particularly in the context of patients who have a diagnosis of cancer. I think we're in a good position. We have more leverage, and there's more impetus for the patient to consider smoking cessation or consider reduction. And hopefully in the context of good continuity of care, a good therapeutic relationship with the patient, we're in a good position to have that conversation, encourage, support, and challenge a patient to reduce tobacco use, or even better, completely cease tobacco use.
Sure. So I think it's really about developing and maintaining that relationship and trust, and trying to work with the patient to understand their specific challenges and barriers to quitting smoking. Obviously, there's different points on the journey of cessation that people are at, and trying to set realistic targets, for wherever they're at that journey, or on that journey. You're trying to push them to the next point. I guess if they're at a point of not thinking about quitting, you're trying to get them to think about it and contemplate it. If they're thinking about it, you're trying to break that down into steps that they can do to try and stop smoking, or for them to understand what steps are involved. And then if they're actually trying to quit, I think trying to support them and encourage them. And then if they fail to quit, then just encouraging them to maybe not look back but look forward, and to have another go when they're ready. So I think my main role is to try and understand where they're at and try and read that, and then try and act on that point wherever they're at. Yeah.
My role would be to support them holistically, because outside of the smoking cessation, which is obviously important at any phase of life, they're now going through a cancer journey with all of its emotional baggage and health challenges in its own right. Certainly supporting them and using the new diagnosis as an opportunity, as an intervention for smoking cessation is worthwhile, and usually take that opportunity. The advantage, I suppose, we have as GPs, we kind of know our patients relatively well. So sometimes you go in with the knife and you just go in hard. Other times you go in gently, depending on their circumstances. I kind of think, within any moment in time, the role for us is to ask the question and gauge where they're at. And some people are ready there and then to quit. Other people are thinking about it, and other people just are not there, even though they know the importance of it.